Firstly, just to make a few obvious points, the first of which has been made, which is the life sciences industry and infrastructure in this country, I think is fantastic. I think we would all recognise that. It is really one of the powerhouse industries and sectors that the United Kingdom has. And we at the NHS, specifically NHS England, absolutely recognise that and recognise that that means that we can both align ourselves with that strength in life sciences, but also take advantage of it for public and patients in this country, but of course globally as well, and use it to develop and deliver healthcare benefits that can be spread to everybody. And I think there are plenty of examples of how that has happened. So in the COVID pandemic, fairly recently, you will know that the NHS led the world in clinical trials, and there was no country, I believe, anywhere else who was able to set up clinical trials at the speed that was set up in this country and deliver results at the pace that was delivered in this country. And of course, that was a benefit for public and patients in this country, but also globally. And that was achieved because the NHS, although, as you all know, is an ecosystem of many different organisations, it does have the ability that other health systems, frankly, don't have, to come together as one very large health system and act collectively. And so that is one example, but there are lots of examples of how we can do that. I'll come to genomics in a minute, which is another good example. But we recognise in NHS England that there is more that we need to do. So we already work, and I often think about life sciences in sort of three buckets. There's the academic relationships. There are many examples of great relationships between the NHS and the universities. If you go to many of our leading universities, you will see health campuses and strategic partnerships with NHS trusts. With large businesses, big pharma companies, if you go to Cambridge, you will see the Cambridge campus, where there is research, pharma and the NHS all co-located. So there are great examples of how we do that. But also innovation comes from many small businesses, many SMEs. I was in India the week before last, leading a trade mission for the government to India. We took 13 mostly companies, a few NHS trusts, to go and show their innovations to the to colleagues in India. And I was struck, as I was the year before when I had the privilege of doing it, just how much innovation was on show and how much interest there was. So we work with small businesses. We have the NHS Innovation Accelerator Programme, the Clinical Entrepreneur Programme, which is specifically aimed at supporting small businesses. But there is more that we can do. I'm not going to say what that is, but I'm going to point you to Roland Sinker's report, which was published just a couple of weeks ago on the innovation ecosystem. We commissioned Roland to take a hard look at what more we needed to do in the NHS to align with life sciences in terms of partnerships. So have a good look at that report. And I think lots that's in it actually overlap with what's in the report today. Finally, we can't do this alone. So the NHS does work, and it does need to work with our industry partners, with our academic partners, but also with our charity partners who are key to this, our small businesses, as I've said, but also patients and public who are absolutely key to ensuring that we can take advantage of the benefit of strong life science and healthcare industries. Just a few words on genomics. We've covered genomics, but genomics is a really great example of how we can get this to work. The NHS Genomic Medicine Service has been mentioned. It was launched in 2018, where we created the infrastructure, the leadership, the culture, the learning system to allow collaborative working with partners in that life sciences ecosystem. And in 23-24, the Genomic Medicine Service delivered 810,000 genomic tests for over 700 rare and inherited diseases and over 200 cancer clinical indications. And we have a number of areas of focus. I'll just mention three of them. Some of them have been touched on, but just to give you an idea of where we're going with this. So the first is on expanding diagnostic testing for rare and inherited diseases, which we mentioned. So that's embedding diagnostic discovery in a feedback loop from research to clinical practice, and that's led over to 130 research publications already, over 3,500 putative new diagnoses being returned to the NHS genomic hubs, and over 85% of those findings clinically reported have been likely pathogenic and therefore resulted in benefit to patients. And so through that NHS Genomic Network of Excellence for Rare and Inherited Disease, we aim to improve pathways, evaluate the potential of new sequencing techniques, improve diagnostic yields, and reduce turnaround times. We're diagnosing more cancers, second area of focus, early and through less invasive testing. So you've heard about the NHS Cancer Vaccines Launchpad, speed up access to personalised cancer vaccine trials. But we're also piloting the introduction of circulating tumour DNA, ctDNA, where we can use blood samples to detect cancer early. And we're increasing the use of cutting-edge, high-throughput, next-generation sequencing. And the final area of focus, just to mention, is population screening. Mike will probably talk about that. And early diagnosis support prevention, as Andrew has said. So that includes delivering the NHS Jewish BRCA testing programme, offering genetic testing to Jewish population across England, regardless of personal cancer status or family history of cancer, to diagnose cancer earlier. Supporting the delivery of the Generation Study, which again you've heard of alongside Genomics England. And finally, working with NHS Blood and Transplant to introduce blood group genotyping to support the better matching of blood and therefore reduce adverse reactions to transfusions, especially in those that need frequent transfusions, such as our sickle cell patients. So just a few examples of how that alignment between life sciences and the NHS works brilliantly. Thank you.